I'm Lidia Schapira. I'm a professor of medicine at Stanford and the director of the Cancer Survivorship Program. As a medical oncologist, the primary question that has always fascinated me and has driven my research and my clinical work is how the people affected by cancer, patients and families, deal with this threat to their lives. And I've been very interested in understanding what matters to them, how to ask the questions, how to build supportive teams to help people through these experiences, and how to uh, provide them with the resources that they need in order to live with and through these illnesses. One of the goals of all of us who are involved in this new emerging field of cancer survivorship is to really mark it as a separate phase in the cancer experience, in the cancer journey, as people describe it. There are so many important aspects of the transition from active patient to long-term survivor, or for those who are living with cancer as a chronic illness. It's so important for us to map out what this experience feels and looks like to patients and caregivers and their family members, and to then think about ways of intervening with supportive education, with resources, and to create a real ecosystem where they feel that all of the different generalists, specialists, therapists involved in their care are working together. So my goals are to improve communication between the clinicians, to provide patients and family caregivers with resources so that they can support their own needs, to educate clinicians in primary care and in other specialties of medicine about the needs of cancer survivors, and to continue the research that we need so that we have a better idea of what matters most and what we need to do in order to improve health outcomes for the growing number of cancer survivors. Even in my early days as a medical oncologist, before we had defined survivorship as a distinct area of study and research, I knew and I understood from watching patients that the end of active treatment for cancer was really a time of anxiety for many, and that they needed some guidance to think about what life would look like after cancer. So, for many of these conversations, I understood what the areas were that required more research, more study, and to begin to develop all of the tools that my colleagues in cancer care and the patients and caregivers that we serve could use to make these transitions smoother, perhaps feel more seamless. One patient in particular taught me many, many lessons that I have since used every single day. And her picture is right behind me in my bookcase. And from her, I learned how to approach many of the aspects of the lived experience of illness for patients with cancer, for people living with cancer, and what it feels like to walk in their shoes. And I've used those lessons every single day as I approach my own clinical practice, as I teach other physicians, and as I think of new questions for research. In developing a program for cancer survivors, I have a few general buckets front and center every day. One is to develop more clinical services that can help cancer survivors and their family members. Another is to provide them with resources and tools that they can use in their own time to better understand how to manage the transition after cancer, or the experience of cancer as a chronic illness. And the third really is to advance the research in this area so we can learn more and teach others more and get better with time. So the resources we need are the collaborative partnerships with patients and caregivers who are our best informants in telling us what is important and what areas are important for research. Of course, we need time and funding to support the careers of young investigators who want to take the knowledge to the next logical step. And we need the opportunity to expand our services and reach more people and scale our resources so that many will be able to benefit, even perhaps those who can't physically come to get their care at Stanford. I find inspiration, frankly, in my clinic every week, just hearing the stories of cancer survivors, and I often take the time to ask them to tell me what was most impactful. I love to read stories written by cancer survivors. I read recently a book that was sent to me by a woman who had had her bone marrow transplant at Stanford and had a nice chat with her over the weekend. My favorite book, one that I would recommend to everybody interested in this field, is a beautiful book written by a young woman, Suleika Jawad, called Between Two Kingdoms. And this describes in beautiful prose the experience of a very young woman diagnosed with a terrible leukemia who survived years of treatment, including very intensive treatments with a bone marrow transplant. And she maps out the experience, the journey, as we often call it, the needs, the psychological and physical traumas she experienced absolutely beautifully. And I was quite inspired reading her story, especially thinking that this population of young adults who are cancer survivors really deserves our attention. Again, wearing a clinical hat, a research hat, and a program director hat. What drew me to Stanford Medicine was really the amazing energy within the walls of the School of Medicine and in the university. I have the opportunity now to collaborate with teams that working in psychology, for instance, on mindset interventions that they've used successfully for people living with other conditions, and we're now beginning to study as a potential tool for cancer survivors. I have the opportunity to work with people who specialize in design thinking and anthropology in all sorts of areas of medicine. And it is these collaborations that are amazing and afford us new ways of thinking about old problems. And I think this is one of the things that makes Stanford so very special.